pregnant women are more likely to be at increased risk for severe illness and worse outcomes with COVID-19 when compared with non-pregnant women. So what does that look like? It basically shows that the adjusted risk ratio, so that's the number of times more likely that you would have a bad outcome. For example, pregnant women are 3 times more likely to require admission to an intensive care unit, and they're 2.9 times more likely to require mechanical ventilation or being put on a ventilator, and they're 1.7 times more likely to die from COVID-19 when pregnant. So those are very concerning numbers, and it looks like now that we have good research on it, there's great evidence that suggests that vaccination is really something that all pregnant women should do when considered as a high-risk group. We know also that pregnant women are at higher risk when infected with COVID-19 of having preterm labor or miscarriage, and that looks like it is a range of about 10 to 25%. When folks have critical illness, meaning they're in the intensive care unit or intubated, that number can reach up to as high as 60%. So one other thing that I'd like everyone to consider, though, is that large organizations, including the American College of Obstetrician Gynecologists as well as the American Society for Reproductive Medicine, strongly endorse the use of COVID-19 vaccination for all pregnant women. One of the other concerns that we have heard is about whether or not the mRNA vaccines may potentially cross the placenta. This is not the case. The mRNA vaccines are injected into the deltoid muscle, which is in your arm, and the mRNA basically degrades inside the cytoplasm, or the inside of the cell of the deltoid muscles, and never reaches anywhere even near the placenta. So there's no risk of the vaccine or the vaccine components interacting with a developing baby. One other concern that we've heard raised is about the effects of the COVID-19 vaccination on the placenta. A number of studies have been performed, and there have been no changes to the placental morphology in those that have received the COVID-19 vaccine when compared with those that have not. One other good piece of news is that the antibodies that are formed in response to the COVID-19 vaccination do cross the placenta in the 3rd trimester, and thus they actually confer passive immunity to a newborn baby.